Hello, my name is Dr. Adrienne Hicks, and I'm the founder and professor of the USMLE Master System. Today I'd like to complete the video series on anemias by discussing our normocytic normochromic anemias. Now for the last two series, we have discussed about if you suspect a patient who is anemic, you should rule out other diseases such as hypothyroidism and check their hematocrit and hemoglobin levels to see if they're low. A normal hematocrit is between 40 and 44, and hemoglobin 13 to 15. So if those levels are low, we should suspect anemia, and then focus on their MCV count. The normal range for MCV is 80 to 100. So today we're going to discuss normocytic normochromic anemias within the normal MCV range of 80 to 100. Now, if they have a normal MCV, then we should focus on other factors such as reticulocyte counts. Reticulocytes are basically our immature red blood cells, and the range for that is 1 to 2. So we have to figure out if the number is too little, meaning that we don't have enough immature red blood cells to form red blood cells, or if we have too many reticulocytes, meaning that we have too many that have not matured to red blood cells. So now let's focus on if we have too little. So if we have too little, that means there's a bone marrow problem. And the acronym that I have to memorize my anemias of normochromic normocytic anemias with bone marrow issues is ARET. A stands for aplastic anemia, the R, renal failure, the other A, anemia of chronic disease, and the T is alpha thalassemia. Now, the first A, aplastic anemia, means that the bone marrow is just not working. It is not producing red blood cells, white blood cells, or even platelets. So the bone marrow is not working at all. Now, the R stands for renal failure. Normally, your kidneys would detect if we have low oxygenated blood and will produce erythropoietin to produce, which will go to the bone marrow to produce more red blood cells. But if you have renal failure, there's nothing to detect this change, and therefore there's nothing to produce erythropoietin to cause the bone marrow to make more red blood cells. Now, the other A, anemia of chronic disease, is very similar to the anemia of chronic disease for which we had in our microcytic hypochromic anemias, but again, this anemia of chronic disease has a normal MCV count, still caused by chronic disease such as cancer, still has the presentation of a normal to high iron level with a low total iron binding capacity. Biggest difference is the MCV count. And the T stands for alpha thalassemia, affecting Asian people. They also have target cells, such as the beta thalassemia with the microcytic hypochromic anemias, but these people have a point mutation in chromosome 16. Now let's focus on a reticulocyte count which is higher than 1 to 2. That means we're producing our reticulocytes or immature red blood cells, but they're not maturing. So the cause could be a structural problem, such as hemolytic anemia caused by G6PD deficiency. Now, these people are normally of Mediterranean descent, but they also could have been exposed to sulfa drugs or have eaten fava beans. Another cause that might be a structural problem is a disease called hereditary spherocytosis caused by a lack of spectrin in the cell membrane. So the membrane is very fragile and it breaks. Another one could be sickle cell anemia where we have hemolysis in areas of low oxygenation which will cause the cell to sickle. So these are various examples of structural problems with a high reticulocyte count. So this concludes our lecture series on anemias. Make sure again that if you suspect a person is anemic, rule out other diseases first. Then check their hematocrit and hemoglobin levels to see if they're low. If they are, focus on the MCV count. That will lead you to either a microcytic hypochromic anemia, a macrocytic hyperchromic anemia, or a normocytic normochromic anemia. Make sure you understand the definitions of these, which means they're either a small, large, or normal size, or they're pale, dark, or of normal color. So pay attention to these different pictures of your cells. In case they don't just describe them, they give you a picture of a blood smear. So if you have any further questions, please send them to me at questions@usmlemastersystem.net and visit our website, www.usmlemastersystem.net.